Welcome to the Gentlefile, a revolutionary approach to root canal treatment. The Gentlefile system includes the proprietary handpiece and as many as 6 files and the EndoClean stand. In this video, we will demonstrate how to use the Gentlefiles and enjoy their benefit. The Gentlefile system is based on the crown-down approach to root canal treatment and blends hand files, the Gentlefiles, and copious irrigation. File advancement in the canal is controlled by gentle continuous pecking movement. This allows the dentist to feel the canal anatomy and control the file's progress in the canal. This contrasts with the pulling in experience characteristic to nickel titanium files and high torque handpieces. The file's movement complies with each canal's unique anatomic structure.
We're going to start with the gray file, the orifice opener. It's shorter than the other files. It's much easier to maneuver. We enter into the canal and we let it go as far as it wants to go. And we go into the next canal as far as it wants to go. We then, again, with the patency file, and after the patency file, we're going to irrigate. At this point, I'm going to choose which file I want to use. If the gray file, like in this case, made good penetration towards the bottom of the canal, I'm not going to use it again. If it binds higher up in the canal, I'll take that gray file and use it again and see how far down the canal it goes. In this case, it goes most of the way down the canal. Here I know I'm within 2-3 millimeters of the apex. I would go straight to the red file and take it to the apex in all the canals. But if I am not going to have an easy case like this, if I'm having trouble getting down the canal, I will use either the green or the blue file to penetrate further down the canal. The blue and green files have less of the flexible tip and therefore have a better ability to penetrate vertically down the canal. And using a very rapid pecking motion, I'll take my K file, I might use a 15. If the red file doesn't penetrate, I'm still stuck. I'm not getting down the canal. I'll go to a K file. First, make sure that there's no blockage. I'm getting patency, but I'm not getting down the canal. I'll take a 25 K file, depending on how it feels. Try to get down the canal. I feel that the 25 is within a millimeter or less of the apex. Back. Now we're getting to full length. And once we've gotten to full length, again, we're going to do a lot of irrigation and check again with the K file to make sure that we have patency. And then I like to take the smallest of the files that I've used, usually the red one, sometimes the yellow. As we all know, most canals are actually oval, and our round instrumentation tends not to clean those walls well. The Gentlefile, because of the way it moves within the canal, will move and clean the walls of the canal beautifully. The file does have a whipping effect. Without changing the shape of the canal, it moves around the solutions, it activates solutions tremendously, and it cleans the non-symmetrical portions of the canal. And when I've finished doing that, we're ready for gutta percha. So if after we've dried the canals, we can see that the gutta percha, usually I'm going to use a 2504. The gutta percha easily gets to the apex. We're ready to fill. It doesn't matter what technique you're using to fill. The Gentlefile creates a shape that is approximately a 0.4 taper. Any of the techniques that you're used to using now will continue to work very nicely with the Gentlefile, and therefore is much more conservative of the original tooth anatomy and its integrity.
In order to maximize the result and efficiency, keep in mind these 4 points. 1. Use the Gentlefile with a rapid pecking motion. 2. Integrate hand files throughout the procedure to maintain patency. and to assist the Gentlefile if it has difficulties in a narrow canal or with hard dentin. 3. Always irrigate the canal after each Gentlefile you use. 4. Finish the preparation with 20 to 30 seconds of activation of the irrigant of choice using the smallest Gentlefile you use to prepare the canal. Generally, 2 to 3 Gentlefiles are sufficient to prepare a canal. For beginning users, we recommend practicing on 10 to 20 canals in extracted teeth before using on a patient. We strongly do not recommend using plastic blocks for practice. Use extracted teeth. For best results, use your clinical judgment to choose the suitable Gentlefile according to the structure and nature of the canal.